Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Felbamate. Its brand name is Felbatol. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Felbamate. We'll then discuss examples of dosing, and finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So in vitro receptor binding studies suggest that Felbamate may be an antagonist at the NMDA receptor complex. Antagonism of the NMDA receptor glycine binding site may block the effects of the excitatory amino acids and suppress seizure activity. In terms of indications or reasons we would prescribe this medication to a patient, well, we may see Felbamate prescribed in the treatment of partial seizures, and this can be with or without generalization. As well, this medication may be used to treat seizures in association with Lennox-Gastaut syndrome. With respect to contraindications or reasons we would not be able to prescribe Felbamate, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Felbamate or to any other component of the formulation. As well, if a patient had a history of blood dyscrasia, they would not use this medication, or if a patient had a history of hepatic dysfunction or liver dysfunction. Now for an example of dosing with Felbamate. In the treatment of a partial seizure, using this medication as monotherapy, we may see an initial dose of 1,200 milligrams per day given orally in 3 or 4 divided doses. The patient may then increase the dosage in 600 milligram increments every 2 weeks to 2,400 milligrams per day as needed, and thereafter to 3,600 milligrams per day if clinically indicated. As with all medications, there are some side effects or adverse reactions that patients may experience while using Felbamate, so we'll go over some of those here now. A loss of appetite may occur in 19 to 55% of patients, and nausea may occur in 7 to 34%. 9 to 39% of patients may experience vomiting, and 18% may experience dizziness. A headache may occur in 7 to 37% of patients, and insomnia may occur at a rate of 8.5 to 17.5%. Somnolence occurs in 19 to 48% of patients. The more serious side effects may include aplastic anemia, acute hepatic failure or liver failure, and suicidal thoughts. Alright everybody, that's all we're going to talk about today with Felbamate or Felbatol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. That's it for today. Take care.